Wow. I did not expect such a big turnout. On a Sunday before the first opening session, so it must be the topic, climate and health. Climate change and health. I think that's why you all are here. Literally standing room, there's not a seat available, and people are still coming in. So thank you for coming. My name is Naveen Rao. I'm the Senior Vice President for Health at Rockefeller Foundation, and it is my sincere honor and pleasure to invite you to this session. We are in for a really illuminating discussion. I have met with all the panelists, and I'm also equally looking forward to an invigorating session. The agenda, as we've organized it, just so that I can run through the agenda, you'll know what to expect for the rest of this session. We'll start with a short video, a really short video, and after that, I will share some of my thoughts on the climate crisis and the impact on health. And then we'll hear from Dr. Maria Nera and Dr. Omina Omrani, who will engage in a conversation about how we bring together climate and health, how we bring together the communities of climate and health. Then we'll be treated with a panel discussion that Dr. Gitinj Gitai will moderate with an extreme group of panelists at the intersection of climate and health. Again, we're staying with the topic, climate change and health, so we can learn more about the existing and emerging solutions. We'll finish the session with another final video, like a bookend, and then that will be the session. I thank you all for choosing this session. You could have been anywhere today, but you've chose to be here, and we'd like to respect that by serving you what we hope will be an interesting and invigorating session. So maybe we can watch the video first.
For decades, frontline voices have been sounding the alarm. The climate crisis is the greatest threat of our lifetime. And for too long, many have ignored the fact that the climate crisis is a health crisis. As a result of the reckless carbon emissions rapidly heating Earth, millions of people are suffering the consequences. Those who have contributed the least to climate change are most vulnerable to its devastating impact. Higher temperatures, changes in rainfall patterns, and disrupted ecosystems are fueling the spread of diseases like malaria, dengue, and cholera to reach further than ever before. Pollution is affecting the air we breathe, from New York to Delhi, and millions are dying each year as a result. Changing climates are affecting every aspect of life as we know it, threatening sources of nutrition, driving displacement, and sparking conflict as scarce resources grow scarcer. Fueled by historic inequity, the climate crisis is reversing global development and threatening people's livelihoods, especially for the women, children, indigenous people, and other communities on the front lines of environmental disaster. But we don't have to accept this reality. Together, we can be the face of change. There is still time to prevent further warming and build climate-resilient systems that leave no one behind. And while the challenge is immense, solutions exist to protect the health of communities across our warming world. Reliable sources of energy, like solar power, help reduce carbon emissions and keep health facilities running in all weather conditions. Water purification can improve access to clean drinking water. Tools like early warning systems to predict and prevent disease outbreaks will save lives. Supporting community health workers, most of whom are women, will help ensure that communities have access to the care they need to live full, healthy lives. And movements like universal health coverage strengthen health systems and social safety nets that are critical in times of crisis. This is an important start, but we must accelerate the pace of progress and take ownership of this challenge. Guided by hope and human ingenuity, we can and must do more to limit warming and save lives. The world needs a new and bold commitment to act for our health and our planet, and we need it now. This is our planet. This is our health. This is our moment.
Thank you. While those images were really searing, just to let you know that throughout this afternoon, we'll be talking about the community, how you can join it, what it means, and what is the call to action here. To me, health is the human face of climate change. And that every image you see of a climate shock is eventually a health shock. Allow me to be the first one to welcome you to this year's World Health Summit. And thank you for building this agenda, for being here today, and realizing that if we don't deal with climate change and health, every other gain we've ever made will go down that sinkhole. We're kicking off the summit talking about climate change because it is the most important issue impacting us today. And it's not only impacting our health, it is also impacting our children's health, our grandchildren's health, and the future generations to come. As daunting as the current crisis may be, we must remember that the decisions we make today are already shaping the lives of generations yet to come. Research has found that in the next 50 years, between 1 and 3 billion people will live in climate conditions that have not been seen on Earth in the last 6,000 years. Those are staggering numbers. It's hard to know how to square them with our daily priorities and translate them into action. For those of us in the health field, it may even seem like this isn't our fight. But we can't allow ourselves to fall victim to that way of thinking. The global community must embrace the transition to renewable energy and net zero carbon emissions, and the health sector must lead by example. Greenhouse gases are killing us. Decarbonization is not someone else's problem, it is ours. At the same time, we must protect people against the many ways in which climate change is already impacting our health. Climate adaptation starts with strengthening the resilience of our health system. We need robust disease surveillances and early warning systems to stop climate-driven disease outbreaks in its track. We need to invest in our health workforce so they can be there for us as the world gets hotter, air gets dirtier, and extreme flooding becomes the new normal. And we must ensure that countries who are most affected by climate change but did the least to cause it have access to the financing they need to protect health. For me personally, what keeps me going is thinking about my grandchildren and the future I wish for them. If you'll indulge me, I'd like to share a letter I've written to them. Dear Shaila and Kiran, I often wonder what your lives will be like in the future. Will you still enjoy going for walks in the park with the dog, riding your bicycles, skipping stones on the lake, and will you eat mangoes outside on a hot summer day, or take a moment to smell the flowers blooming in the spring? Things we enjoy doing together. Whatever your future holds, I hope that you are happy and healthy and that your lives are filled with promise. I hope that in a world you inherit simple pleasures that are still possible. From where I sit today, the future I wish for you is far from guaranteed. The world as we know it is changing. Floods in the desert, fire on the sea, poison air, deadly heat, vanishing water. People's lives are plagued by disruption, displacement, and destruction. It is deeply saddening to me, but I'm resolved to do my part. Building a habitable, heritable future is my generation's duty to yours and those that follow. You, your children, and your children's children should have a right to the same health and happiness I have enjoyed. I'm confident that this future is possible. And I commit to you that I will dedicate myself every day to make this future a reality for you and your grandchildren. My love forever, your Tata. This is the spirit behind today's conversation. It is the purpose of our work. Let me be clear. We all have a part to play in building a greener, more resilient future. The global health community is a powerful force for change. Today, we'll hear from experts and advocates who are leading the charge for climate change and health innovation. I hope that you will be inspired by their words and join the movement we are building for coordination and collective action at the intersection of climate and health. But for now, on behalf of the Rockefeller Foundation, I'd like to thank you all for being here. Please join me in welcoming our next two speakers to the stage, Dr. Maria Neira. Dr. Neira is the WHO Director for Environment and Social Determinants of Health at the WHO, and Dr. Amina Omrani. Dr. Omrani is the first official youth envoy for COP27. They'll discuss the actions that need to be taken by health organizations and the climate advocacy community to both mitigate the impact of climate change in our health and adapt health systems to a resilience in a warming world. Maria and Amina, the floor is yours. Really expecting a lot of fireworks here. You have the two ends, and would love to hear it. So please, over to you.
Okay. Can you hear me? Okay. So first of all, thank you so much for having us. And I feel very excited and privileged to be with Maria today. She has been my role model since I was a third-year medical student working on climate change and health. And it's just amazing to be with her today. So we know that your incredible work and leadership focuses on the social and environmental determinants of health. So how does WHO see the impact of climate change on these determinants, and what is WHO doing to address that?
Thank you, and it's as well a privilege for me as well, and thank you, Naveen, for putting us together. I'm wondering how many people knows who represent the young generation, and they all won. Anyway, I admire you as well, and I am convinced that the wall is on your hands with a little bit of support from us as well. So WHO has been working, as you well know, on demonstrating the very strong connection of climate change, pollution, and health, because I want to put these three things together. And maybe I will start with a number that is fundamental in all of this dialogue. The 7 million premature deaths caused by air pollution, exposure to air pollution. Where is this pollution coming from? From the air we breathe, from the combustion of fossil fuels. And this is one of the reasons that WHO decided that climate change and health was one of the biggest public health challenges, but at the same time, a biggest public health opportunity. So we started to put the scientific evidence together, working with the Lancet Countdown, all of the groups that are working on putting this enormous evidence that the weight is so big. Then we started to infiltrate ourselves on the big negotiation, the COPs. The first time we went to COP, Anja is here and many other people, we were 3-4 people representing health. Today, fortunately, we are a big community putting the lunch at the COP27. Remember this big sculpture representing our lungs that we took to the COP27 to represent, to make sure that everybody will understand that we were talking about health, and the face of the climate change is health. Then what we did, we started to put projects on the countries, doing a vulnerability assessment, how climate change will be affecting, which type of diseases. We are working with the ministers doing the resolutions. We are telling them that if we take the right choices on the mitigation of climate change, that could be the most exciting agenda on public health ever, the ultimate opportunity on public health. And we are trying to reduce our own emissions as a health system. We are trying to make sure that people will gain access to clean energy with solarization. And we are obviously trying to mobilize and now bringing all of this health community to the COP28. But you know me, so I can keep talking a lot, and I don't want to over to you now. Let me ask you another question. You have been engaged on climate change. You are a youth delegate, the first ever of the COP27. What are the youth people saying? Are they aware of the connections between climate change and health? What are the medical students think about this connection? Do they feel engaged, or they feel completely powerless?
Yeah. So in terms of how do young people see health and climate change, we see that as young people, particularly children and adolescents, we have a responsibility towards them. We know that we are shouldering the impacts of climate change on our health and mental well-being. And this is one of the biggest challenges young people are facing. We see how the decisions that are being made for us are not made with us. And there's a lack of meaningful integration of youth-led perspectives in a way that reflects our own needs and how climate change disproportionately affects us. I say that because when we look at the numbers and the reports that are being released, 1 out of 5 children globally do not have access to safe drinking water. And we talked about air pollution, and 9 out of 10 children breathe in polluted air. And this leads to detrimental impacts on their growing body and brain. And as medical students in my past life, we have this responsibility of not just addressing our duty of care to our patients, but to our communities and to the environment which our health depends on. And seeing this is so important. But there's another element that young people really is affected by, which is around our mental health. I was recently, 2 weeks ago, facilitating a dialogue with young people on how climate change affects their mental health. And in my breakout room, a young man from Nigeria opened his camera to show us that his house has been flooded. And he said, I'm here to tell my story, how my mental health and the health of my family is being affected. And these are the stories that we as young people are working towards elevating. We believe that data is so important, and we want to build the research capacity, particularly of young people, to do that. But we also want to bring in the frontline stories in conjunction with these data to make sure and to push our countries not to backtrack on their commitments, because it is affecting our health and our future the most. But I will also be speaking forever about that, so I will turn back to you, Maria. And we heard from Naveen about the importance of the role of the health sector. But from your perspective, what does the health sector play a role in when it comes to mitigating climate change and limiting global temperature below 1.5?
Thank you, Omnia. And you mentioned that this young student, his house was flooded. This is unacceptable. These things are happening every day now. Floodings and people losing their capacity to grow and do agricultural production. They are breathing air that is killing us, literally. And our next generation, I mean, I don't have grandchildren, but I hope one day I will. So I don't like to give them this data. So what the health community is doing, I have to confess that years ago, the health community was a little bit disempowered. They realized that climate change was affecting infectious diseases. They see more cases of malaria, of dengue, non-communicable diseases, weather, extreme events, name it, touching the pillars of our health, the access to food, access to water, access to clean air and shelter. But they feel a little bit, okay, this is not our agenda. So it took us a while to make sure that the health community will understand that we have a huge role here. First, because we need to lead. We need to lead those three transitions that are fundamental. The transition to clean sources of energy to stop this pollution and climate change, the transition to sustainable food systems, and the transition to healthy urban planning. And if it's not the health sector leading, I don't know who. Because when you put the health argument at front, then the motivation is huge. The moment a mom realized that the asthma cases of her child or grandchildren is linked to the combustion of fossil fuels, I mean, the air pollution, wow, that moment is fantastic, it's irreversible. So the moment that the health community realized that, they can do many things, and now they are very motivated. We can decarbonize the health system, and that's very rewarding. Of course, this is for medium and high-income countries. The low-income countries, they are not contributing to the carbon footprint, so they cannot decarbonize. On the contrary, they need to gain access to clean energy. Second, we can talk to our patients and say, listen, instead of looking at giving you an asthma, a treatment for asthma, look at where you are living, the levels of pollution, talk to your mayor, protest, engage, vote differently, make sure that you engage on mobilizing. And I see more and more the health sector involved. We are already paying the price because our health community is the one already coping with the consequences of climate change, and now they want to cope as well with the solutions and live the solution. But let me ask you something. I mean, how can you make sure that the youth are motivated and not depressed? Because as you say, the mental health is an issue, but do you see any light on all of this, any motivation? How can we make sure that we involve you a little bit more on all of these negotiations and treatments? How can you use a little bit more the health argument that we are trying to put together?
Yeah, thank you for this great question. And I see it through three different lenses. The first is when young people are recognized as a diverse group according to our background, our areas of expertise, the insights that we bring in from the communities, and then after we open up a little bit the space within our governments, our institutions, our private sector, to include youth representatives, as well as youth advisory groups or the WHO Youth Council that has been established. This is an opportunity and a way to motivate young people to be seen as equal stakeholders with their own insights and can then help influence and translate the action that we're doing on the ground into the policies and shaping it in a way that it is responding to our needs and the needs of our community. I was very fortunate that my country decided to appoint a young representative within the presidency, and my task was to meaningfully listen and to integrate what young people are feeling into the delivery of COP up to the political outcome decision. But I have to recognize that it took 27 years for a COP presidency to realize that they will appoint a young person at the highest level of decision-making for climate change. And this has to change. And this is how I see us as the beautiful global health community, that we can bring this in the work that we're doing, in bringing in the perspectives, the insights, and the local actions that young people are doing. I believe that we feel the burden, but this brings us a lot of motivation because we don't say climate action, we say climate justice, because we have a responsibility to our next generation, to the communities that are most affected. We always take a step back, and we hear a lot when it comes to climate action. We hear innovation, technology, best buy, cost effectiveness. But as young people, we take a step back and ask, what do we mean by best buy? Best buy for whom? For young people, children, best buy for elderly, for climate migrants. It's so different, and we want to, yes, embrace this innovation lens that many institutions, the private sector funders look at, but we want the solutions that are being led by us and led by others to reflect the needs of the communities that we represent and we work with at the front line. So I will throw it back again. And this, I think, will be a question that I would love to hear your inputs on. I just talked about climate justice and about how communities are disproportionately affected. So how, in your opinion, what can the health community and the health experts that are with us in the room make sure or work towards that climate adaptation mitigation efforts reflect and include these marginalized communities?
Thank you, Omnia. And you said that it took 27 years to appoint a youth delegate. Well, it's taking almost 30 years to keep talking about climate change at the different COPs. So maybe we are missing a little bit the sense of urgency that is associated with that. So one of the reasons why we need to take an urgent decision is because the most vulnerable are the most affected. When you see how those floodings and extreme weather events are affecting people, is really dramatic, and we should move a little bit. We cannot wait another COP28 means 28 years of negotiations. Is absolutely unacceptable. This year we will have, for the first time ever, as you know, a health day, and we thank you very much that we have an incredibly high expectation at the level of the magnitude of the problem. So we need to make sure that we bring the voices of those millions and millions that are already affected by climate change. But two messages here. One, zero regrets. Most of the interventions that we need to put in place for the adaptation to climate change, to cope with the consequences of climate change, are the so-called basic public health interventions. We need to make sure people will have access to safe water, sanitation, electricity, the minimum vector control, epidemiological surveillance for the climate-sensitive diseases. We need to promote and enforce on a very strong way all of those interventions to cope with the consequences that we cannot avoid already. But we need to do it particularly for those very much at risk. And WHO, as you well know, is trying to mobilize, and we have this operational framework that we are launching now, all of those building blocks and recommendations on how to move now on this adaptation, climate-resilient health systems that we need. So this is the zero regrets, because those are interventions and investments that you have no regrets at all. They are good no matter what. And the second message is a positive one. People want to hear, and particularly the most vulnerable, not only how much this is affecting them, but our politicians, maybe they will move a little bit more if we give them positive messages. See, if you tackle the causes of climate change, if you mitigate climate change, look at how many lives you can save. And this is working very well with mayors, for instance. When we are telling mayors, listen, if you put a sustainable transport system for commuting in your city, look how much the air pollution is going down and the number of lives you are saving. And not only the number of lives, I hate this argument, but our health systems are paying a very strong cost as well financially. So that's an argument that maybe will move some politicians. Politicians need to do politics, and the politics here is putting the fossil fuels in the fossil place where they belong and start to accelerate these renewables. Don't give subsidies. This is a message that I want you to. Do you think that the youth are prepared to be kind of provocative, big activists, and say to your politicians, stop giving subsidies to fossil fuels, because those are then creating a big problem with chronic respiratory diseases and others? Are you ready?
Yes.
Good.
The answer is yes.
Me too.
Join us. It is so critical, and this is one of the biggest campaigns that now young people are coming together from all the different spaces, from the climate space, from the health space, which is to really push for equitable fossil fuel phase out. We know that this is impacting our health the most. It is killing us, and it is leading not just only to the acute diseases that we are seeing, and it is also affecting our mental health because we can see how the influence of corporations, and we can see it in everywhere, whether it's in our governments or in institutions. And as young people, we feel that it is our right and the rights of the future generations to put an end to that. Because we can see the detrimental impacts of that on our children, on the adolescents, but we also can see that on their future. And it is so inspiring for me and for many of you as well to see a lot of children advocating for climate change, right? And doing a lot of initiatives in their schools. But I personally did not worry about climate change. And I don't think that children and adolescents should. And we should put that and really fight against climate change to make sure that they have nothing to worry about when it comes to their future, because it is their fundamental right to a safe, clean, and healthy environment, which is what we have advocated for together for COP27. We have that mentioned, and it's so critical that this right we always remind ourselves with. It is a right to the next generations and to the current one to have. And as young people, we are mobilizing, and we are not giving up on that.
No way. We are giving up with the time, that yes, we need to go. But allow me to say that I don't know about you, but I have hope after this conversation and hearing from Omnia. I think I'm a pathological optimistic, but now even more, having this generation behind us, I think we can move. Let's use this health argument on a very strong way. At the end of the day, don't you think we are proposing something which is only common sense? I mean, stop fighting with nature, look for sources of energy that will not kill you and suffocating you, promote cities that will have a more sustainable transport system, protect people who are more vulnerable, and make sure that they have the health system that is the one we need, and stop this nonsense and go for a common sense approach. So together, maybe we will be able to do it. Thank you so much, Omnia. It has been really a pleasure. Thank you all. Thank you.
I don't know about you, but I could have kept them going, kept listening, because it was just wonderful to hear the energy, your commitment and passion. It actually gives me hope also. So much, much appreciated. Opportunities like these, where we can bring climate advocates and health leaders together, are critical on our path to true and durable climate resilience. It is now my pleasure to introduce Dr. Gitinji Gitai, CEO of Amref Health Africa, who will do us the honor of moderating a discussion with 4 passionate experts, all working on solutions at the intersection of health and climate. I ran into Gitinji just before the session started, and he promised me he was going to shake it up. Over to the master.
Thanks, Naveen. Thanks, Naveen. And to Maria and Omnia, thank you very much. A big hand for them again. That was fantastic. Not climate action, climate justice, and stop the nonsense and move to the common sense. True? That's a summary. That's all I had. I don't know about you, but that's all I had. Yeah? So today, after this now, we are going to get a good mix of thinkers, doers around this area. So I'm going to call the panelists up here. And the issue that we are going to be looking at is that there's a lot of gloom and doom on this climate change and health issue. As has been said by Naveen and everyone else here, human life is the face of this climate crisis. The climate crisis is going to be counted in human life. So far, we're talking over 50 years, 2 million lives lost, more than $4 trillion in economic losses. But we are saying that actually there are pockets of hope. And Maria said, as she ended there, she said, I feel hopeful. And I think we feel hopeful also because of the energy we see with the young people, because of innovation, because of what people are doing, because of the power that rests in the communities. And as I keep saying, we are all communities. Even here, wherever we come from, we are communities. We have power. And that's the power I want to look at. And I'm going to call here the right mix. Can you imagine we are going to have a panel here of a researcher, epidemiologists, We are going to have a mobilizer of public engagement. We are going to have a World Bank health economist. We are going to have somebody who's mobilized over $18 billion for Gavi. What can't we do? So, let me call my panelists here. Dr. Ethel Maciel is the Secretary of Health, Surveillance and Environment in the Ministry of Health, Brazil. We have George Mwangala, Campaign Director and Africa Lead at Purpose. We have Dr. Monique Vlada, Head of Global Health, Nutrition and Population. She used to head the GFF. Welcome, Monique. And finally, I have with me Marie-Ange Sarakayao, who is the Chief Resource Mobilization and Growth Officer at Gavi. What power? There's nothing we can do. So Naveen, thank you for bringing such a powerful team together. And I also said in the morning that I am going to celebrate every panel that has gender balance. This is yet another panel that has good gender balance. So celebrate the organizers. Thank you. We are going to go straight to the conversations. And we are going to keep this positive, say, hope. We picked up on the hope word. We keep going, yeah? So let me start with Dr. Ethel. And we are really glad that you're here. You know, there has been a lot of conversations around Brazil. Brazil, and many of us who've heard about this here, Brazil, like, oh, this is the world's carbon sink. We have to save it. But let's look at the people in Brazil. What are they going through? What is their experience of this climate change? And what are the communities and the government that you represent doing to ensure that actually we come out of this crisis? Because we know there is hope. So how do we build the hope? So you could share a bit of this hope. What are the experiences and what are the people in Brazil and the government doing in terms of technology, innovation to build this hope agenda?
Thank you. So first of all, I'd like to thank you, Rockefeller, Dr. Navi, for this opportunity. And I'm here to represent Brazil government. And it's a very challenging task because we are the new government in Brazil. And in the way of climate change, until December 2022, we are discussing if the Earth was flat or not. This is the kind unfortunately, that we have in Brazil, so we had in Brazil. And climate change does not exist. So it's important to understand that Brazil is a very complex country, as a lot of others. And in this very complex world, we are divided in what we think. And unfortunately, this COVID-19 pandemic divide us more than we were before, unfortunately. And we have this in this new government, the President Lula make a very clear statement about climate change. And as we live by symbols, he renamed the Minister of Environment from Minister of Environment and Climate Change, as the Minister Marina is leading these efforts. And for the Secretary of Health in Brazil became Secretary of Health and Environment. So this is not only words, it's what we think about this. So we brought again, if I say that, the climate change to the table and for the communities in Brazil. We have a very large period in this 4 year of deforestation in our country, and this, without the El Nino, have a very huge impact in our country right now. As I speak, we have right now a flood in the south of Brazil with a lot of people out of their home and with a lot of sadness for this south region in Brazil. And in the other side, we have a severe dry in the north area, in the Amazon forest, and for this population that live there. And in some of in this area in Brazil, we only reach them by navigation. So as we don't have water to navigate, we have problem with how to bring the supplies, food, and everything. And climate change is a reality right now in our country. It's not one thing that we are discussing about the future or about what we expect that. It's happened now. And luckily, we have this new government that put this as a priority. So we have, I think you have opportunity to speak later, but I would like to finish my first intervention saying that we have, by the President Lula, interministerial committee leading by our Minister Marina, and that work with all the ministers, include Minister of Health. This is leading by Ministra Nízia Trindade. Is our, in all the Brazilian history, she is the first woman as a Minister of Health in Brazil. And it's a huge challenge and a very important step that President Lula chose a scientist and a woman to lead the Minister of Health in Brazil. And these make a lot of difference already in this 10 months that we are in charge with this job. So thank you very much.
Thank you very much. Tell me, are we saving the rainforest?
Yes, right now, I'm sure. We already, in this 10 months, reduce 50% of what we are doing in the last 4 years. So in 10 months, we already do that. It's not an easy task because we have a illegal market that was there. And unfortunately, this is a very important conversation in this room because people that buy this illegal, it's not in our country. So it's important to say that all of us has the responsibility to save the forest.
Fantastic. Thank you very much. And
thank you.
I thank you for that. And we'll come back to you later to hear a little more about what kind of partnerships you're creating. But let me come to you, Marie-Ange. I know you didn't expect me to come straight to you, but I will. And the reason I'm doing that is because as we discuss this intersection, climate change, health, I was discussing the role of environment here with Professor Rhoda from Makerere. So disease patterns are going to change. And the Global Vaccine Alliance is at the center of this. You guys are developing the tools, innovations that are going to actually tackle the problems that we are going to, we're talking about 250,000 lives are going to be lost additional by 2030 because of things like malaria, diarrhea, and we have other things coming up, chikungunya, that's all these things. So how do we ensure we have the right tools to go ahead of us as we tackle the climate crisis, and how do we ensure they reach the last mile? So could comment on that so that we link this to the environmental agenda. Then I'm going to come to George and ask whether the people out there really know and care.
Yes, and indeed, I think on the positive side, following on Maria, I mean, some of the powerful tools are there. And these tools are, of course, first, the importance of surveillance, indeed, surveillance and diagnostic, particularly in the health systems. And for example, in the case of Brazil, it's one of the most important health systems in the world. So the first tool will be to have, of course, surveillance and diagnostic in the health system. The second one, of course, and I think that's where also there is optimism, is that we already have in Gavi, vaccines for 6 of the very climate-sensitive, diseases. And it was mentioned a little bit in the video that we had at the beginning, yellow fever, malaria, and very good news on malaria on the second vaccine.
Yeah, let's celebrate science also. Let's celebrate science. Yeah. The new vaccine, yes.
Typhoid, so these vaccines are available. I think where we have really the unique opportunity right now, as you know, every 5 years we develop our strategy, and we are in the midst of developing this strategy. So it's all the more important that actually we increase and plan for the expanded use of these vaccines. You know, knowing also that, of course, with climate change, you have an increase in geographic scope, but also, as you said, and we have seen, unfortunately, is that often the impact is on the most vulnerable, and there we do have a fragility and emergency policy that allow us immediately to provide support. We did that for Pakistan when there was a flood and other countries. I think the main issue will be to make systematic, because right now, you know, in a sense, in our vaccine portfolio, we do have some of these vaccines that are in the routine program, so it's about planning and increasing the access, of course, working on production and diversifying, but some of them also are in our toolkit of outbreak response, stockpile. Gavi manages the stockpile for all the most important outbreaks response. So if there's an outbreak in any country, we'll send it. So I think the truth is that some of these diseases won't just be on outbreaks and become permanent, and we have to plan for it. But now is the time, because we are working on our 5-year strategy. And also, as part of this 5-year strategy, we do also have a 5-year vaccine investment strategy where we are looking at investments like dengue that now is spreading so much. Now I understand it's in Europe and more in the northern hemisphere. So the good news is that the tools are there and the scientists have been working. So how we are going to spread, how we are going to expand this tool. There's, of course, the health system that will be very important, strengthening it even further, and most importantly, greening it. And I'm looking at Maria because we have also this important program of solarization of health facilities that is very important, together with a platform for the cold chain modernization that we have been having for some time. And already we have been introducing, grade A equipment so that, again, on the mitigation side can really help. So these are some of the things that are here, but that we'll have to do much more systematically, and but also not to forget innovation, because that will be very, very important. But I'll stop there.
Thank you. Thank you very, very much. Can I send you and Maria to some people? I want to send you to Gavi and Maria to WHO to tell them that now, when next time we have a pandemic, the stockpiles of vaccines should not wait for the outbreak to go to Europe for them to be released. So it's just a message for you to deliver, so that the stockpile. Oh, Chikwe, welcome. just in time. So the stockpiles must be responsive, because speed will be necessary. Thank you very much, and thanks for nodding to accept that message. And now you have a third musketeer here, Chikwe. So thank you, Chikwe, and you support this agenda. Yes. So let me come to you, George. I grew up in a coffee growing area in central Kenya. And when we grew up, every Saturday we would go and pick coffee, put it on our backs, take it to the factory. That's how we were educated, small farm. When I talk to my mother now, she's 89, she says, the coffee cycles now are not reliable. We don't know what happened now. I am not sure whether to actually prepare the coffee, because even when it flowers, I wake up in the morning and all the flowers are gone. So I'm kind of becoming, but she doesn't know that's called climate change. She doesn't have a name for it. So how do we engage the people? How do we make sure that the people are part of this conversation? We saw during COVID that actually trust with communities, where it was absent, the response to COVID became weaker. Where trust was good, the response to COVID was better, including vaccination. It was dependent on the trust foundation. So how do we build this trust before we need it, ahead of the crisis?
Thanks, Dr. one thing we all agree is that climate change is a crisis, right? And climate change is not just a crisis, it's a health crisis. One other thing we have done is we have, for a long time, described climate change as an existential threat to humanity. Why do we always describe it as an existential threat? We are looking at climate from the future, whereas for a lot of communities, climate is now. For your grandmother, climate is now. But she essentially just can't describe climate as climate. She needs to describe climate from, the rain patterns have changed. So she can't prepare her land. When it comes to health, communities are seeing the change and the change of pattern into how malaria spread. In Kenya, right, where we come from, malaria was prone in the western region of Kenya. Now Nairobi has malaria. So for people living in Nairobi, they know malaria is in Nairobi, so they know how to adapt. Now we have mosquito nets. People are prepared. But they do not link it to climate because they do not know. And then a conversation that Dr. Omnia and Dr. Maria had, and there was a conversation around the language we use. Mm-hmm. So we speak to politicians. What do politicians care about? They don't, yes, they do care about science, they do care about data, but it's not about 10,000 people, it's about one person, then two, then three. So we speak about climate in 2050, and then we say, in 2050 we will, right? Whereas the politicians care about tomorrow, they care about re-election. And the re-election is about the people. We don't link climate and health to people's lived experiences, to people's day-to-day life. That's where we go wrong. And during COVID, what really made a success was we told people COVID is here and it's about life and death. You either wear a mask or you contract COVID. If you contract COVID, there's a high chances of you dying. So communities knew, yes, the risk perception is high, but there's something I can do that is within my reach, which was wearing a mask or washing hands. And you were very good, Dr. Githinji, in educating communities and telling them it's not rocket science. It's
Thank you. I didn't pay him, I promise. I didn't pay him.
Pick a mask. When it came to vaccination, we also told people, yeah, you can worry about the vaccine, but you worry about it today, but you get it, you're safe. So communities believed, right? We also made sure that we were not communicating to communities from a foreign language. We were talking to them in their local language, in their mother tongue, right? We were talking to them not with celebrities on TV. We were sending religious leaders. We were working with community health volunteers. We were working with the people they trusted. It could be a grocery vendor, and the grocery vendor would have a hand washing, system around there. So they say, before you get vegetables, wash your hands. It was simple communicating. So we have to do the same for climate and health. We have to get communities to understand, make it very livable for them, connect to the things they're doing, but most important, the solutions that are within their reach. That's what I would say.
Fantastic. Thank you very much. So we need to break down the language. Yeah, you can clap. We need to break down the language,
exactly,
something that people understand. So we'll come back to that to hear a little more from you on what kind of language do we need. Now, let's talk about, as I said, it's a really good mix here. We have epidemiologists, scientists, people mobilizer, resource mobilizer, and we have the World Bank. The World Bank, yeah? Now, I have been listening to the president, Ajay Banga, and I think he's a great guy, yeah? Do you think so? He's a good guy.
Looks
and
like it.
I heard him say that we need to make the bank better before we make it bigger, yeah? And that better means responsiveness and speed to these challenges we are having. We can't wait for the World Bank to approve a climate resilient fund. I had him talk about sometimes it takes 8 years to approve a government program. I think I'm wrong on the number. So how is the World Bank changing to actually ensure that it's responsive to this crisis? $33 billion, I think, last year, or $31 billion or something, into climate financing through your lending. But how is your overall program changing to ensure that we are responsive to the needs of the communities, either mitigation or adaptation, as you listen to? How is it responding to Brazil, for example?
Great. Well, first of all, thank you for the opportunity. I really appreciate to be here. This is an incredibly important discussion. Before I get started, I just want to rectify one thing. You didn't get your facts entirely straight because you called me a health economist, which threw me immediately in an identity crisis. But I'm a public health physician, surrounded by a lot of economists. But there's a difference there. And we have a lonely group of 4 that keeps on very close in the World Bank, as we also have a valuable perspective on the world. But setting that aside, maybe. And I'm so glad you start with Banga, because he not only said that, but he also said effectively we no longer have a livable planet, right? And he changed the vision statement for the bank in his first week to make that part of our overall goal and objective of our work and all of our engagement with all of our important clients, including Brazil and others. And I think this is so important when you think about and listen to George on the examples, right? And it's the livelihoods of people, and it's our ability to keep our children and the future generations safe, right? And so that's where I wanted to start. And then secondly, I think it's really important that we keep the concept and the definitions around it broad. It's easy to go into specific diseases, but if you just look at the increase in temperature and the impact on maternal outcomes, for example, you see a dramatic increase of complications in pregnancy with 1 degree increase in temperature, right? If you look at the impact on NCDs, and so infectious disease, we have covered really well. Gavi played an incredibly important role. And thank God we have the industry and the capacity now to have those kind of approaches. But at the basic, fundamentally, we need to think differently about how we support the development and implementation of health systems to be able to address these challenges. And that means we have to look at the public health function, right? And so across all of the countries, there should be a strong ability to have laboratory diagnostics and surveillance. But we also need to look at resilience in primary healthcare delivery and the quality of the services that are being provided. And we also need to look at the financing. And so at the World Bank, our Climate and Health Program looks at how we transform the $34 billion that the bank invests in health systems in a way that they are climate responsive. And that's a revolution in terms of the speed with which we're going towards implementation on that. Then secondly, it's a multi-sectoral agenda. And so in this day and age, the number of facilities that don't have water supply. So can you imagine doing a delivery without clean water? Right, and I believe now it was earlier this week at WHO and really important partners for us that there are now 30 countries with cholera outbreaks. Right, and these countries have cholera outbreaks exactly in those areas where the most vulnerable people live and where you don't have clean water supply. Right, and so yes, we need to do vaccinations, it's really, really important, but at the basic of it, we need to provide those services that make it that people have a chance to resist all of these challenges that you're seeing as the impact of climate. I'm just going to check whether, I wanted to make the point, you said it very eloquently on equity. It's really not the same for everybody, and vulnerability really determines an outcome. And so in everything we do collectively, we have to take into consideration who are we actually reaching with these interventions, and who are those that are most in need. Thanks.
Excellent. Thank you very much. So, yeah. So the bank is responding. It's looking not only on particular diseases, looking at a systems approach. It's looking across not only health sector, water, sanitation, agriculture. So in Brazil, let me come back to you, Ethel. So what kind of multi-sectoral arrangements are you having in the government? Are you bringing different sectors together to address this climate change issue so that actually you can save the lives of the Brazilian people? Could we hear a little about that?
Yes, we are doing this. We used to have in the past like a committee with all the ministers in Brazil. there is a 32 minister, so it's a complicated arrangement. And right now, this was rebuilding just last month, and we have this all minister work together in the climate change subject. So this is a very, as I told, it's a priority right now. But besides that, we are very worried about, we live in a new world with old regulations. And we are very worried about this because as the social media and the algorithms are dealing our lives and our thoughts and the politics in the world, we are very worried about this. And we are looking for regulation this issue in Brazil. And we have some platforms that is responsible for spread some fake news that is very important for our lives. So this must be seen as a public health problem. As in one platform say that you don't take your vaccine because vaccine will be give you like HIV, as we had in Brazil. They must be responsible for that. It's the new world and needs new regulations. So right now in Brazil, this is a very hot topic about how we can regulate this virtual world. Because in a non-analogic world, we cannot say for each other some things that we are doing in a virtual world. So, and climate change is in the middle of this because they shape out some way that community thinks about this, and we are very worried about what is happening in Brazil and other countries, but we are worried about the Brazil regulation, and we discussing right now in the Congress this. And does, example, if I have like more 30 seconds, in the date that this law was passed in the Congress, the day before, the platforms, and I'm not naming them, but everybody knows, and who is the donors, they shut down the vote. We have to take, so we have to talk about democracy in the world. A lot of things change, and we need to put this in our. We have to take the elephant in the room and say that in a very loud and clear.
Absolutely. Yeah. We have to deal with the difficult issues of democracy, human rights, misinformation. I saw that the Africa CDC is actually investing in a system of rumor management to ensure that we can actually reduce false information and its impact on public health. So they've done a call to get a digital system on rumor management. Let me come to you, Angie, again, because I said Angie has actually mobilized more than $18 billion for Gavi. We need to clap for her, because that's actually what has been helping the children out there. So let me now come to this. How do we create, like we've been doing before, how do we create investment cases to the funders, who many of them are in this room, and the government that give Gavi money, for them to actually put more money into climate resilient health systems through Gavi for the future? How do you see that happening? How would we do that?
Actually, I think one of the first things, coming back to what George said, is really, of course, thinking about the audience, and also Ethel. I think it is very important today to really think about the messages to the audience. So the messages to that type of audience is, by investing in health, it's actually really a marginal investment compared to the impact that you can have, or compared to another channel of investments. Because in a sense, as you have seen here, and I think we all talked about it, significant investments are already going on. And some of the tools are there, whether it's diagnostic, surveillance, or vaccines. Of course, they can be increased upon, but it's this delta that is important, and I think is going to be important for the funders when you have so many priorities, to think that by investing better, as Monique just mentioned, and others here, you can actually really tackle in the easiest way. And guess what? Even in a politician lifetime, and that's quite important, of course, because, election happened. It just happened that next year, for example, pretty much a lot of the funders are going through elections. So you do need to speak also to a broad group. But this is about people. It's actually the people-facing side of climate change. Of course, we have heard a lot in the past about climate change and impact on infrastructure, and impact on various things, but this is really the people facing, and in a sense, is first start with this, you can actually make that investment, and you know what? It will be marginal compared to if you start from scratch or if you go to another channel, because the tools are there. So whether it's investing in diagnostic or surveillance, but it's about being very systematic here. That's what we are talking about. Because we have been doing it on and off, because it was about outbreaks, because we didn't quite have the evidence. It's also really about investing in evidence. So we do have, and we will do that, making clearly the case to the founders that when actually you invest in health, you can have both the benefit on climate and on health. It's also because when you look at the tools that you have, this is actually the best tool. The prevention, finding it in advance, but of course, making it available, and the access will be extremely important to everyone, and being able to explain. But I think that will be the first thing. Of course, there's also the greening of health system that will be important. For a lot of the founders, they have been investing in this system for many years. While it's imperfect, it actually delivered. While we have been maybe not fully satisfied with how it performed during the pandemic, it's a system that delivered 3 times more during the pandemic than in a normal year. So that's because there were investments. So they need to be continued. So I think that's also not losing the gains of the past 20 years, or, and it has been said, is critical, because you don't want to set back. Finally, I think it's also, there's innovation. Look, it's innovation. Science was able to bring a vaccine in, 9 months, when it typically took 10 years. There's a lot of innovation coming up, and it's actually possible, but simple innovation in delivery, to the point that has been made here by Maria, by Monique, and others. Now we are helping some countries actually deliver vaccine by drones, and it's 90% better than using fuel and all kinds of vehicles that, pollute. And it's faster, it's cheaper, it's 50% cheaper for the cost of immunization.
Thank you.
So it's possible. We can do it.
So it's possible.
All together. And it starts here, of course.
It's possible. Thank you very much.
Thank you.
And thank you for that. And in 1 minute, maybe I'll come back to you, Monique, in just a minute. Do you think there are partnerships that we are leaving behind, or partnerships that we need to accelerate? If you could just comment on that in a minute.
So because you gave me only 1 minute, right? So I'm going to say,
I'm very mean.
I'm a deep believer in collective leadership. This is a huge agenda, and we can only really make progress if we look at comparative advantage and mandate, and create strong political commitment around this agenda. And so at the World Bank, we're really looking forward to COP28, and we'll also be around the climate and health agenda, making a a commitment and another announcement, which is a line of, which is a work program we really want to do collectively with others. And so, of course, WHO plays an important role. We have donors, we have foundations, we have technical agencies, there's research, etc. So there's a lot that needs to be done. But the monumental size of what needs to happen can only really be done if we do this collectively.
Great, thank you very much. And we'll give the last word to George. We'll give it to the people. What do the people need to do? 1 minute.
Thanks. I think to think about the people, we need to create agency for them, especially on this conversation around climate and health. How do we create agency and create urgency? How do we make them understand the interconnection and the relation between climate and health? And then build them as advocates to the decision makers, be it the political leaders, be it the funders to provide resource, be it the corporate world, but it's create agency and urgency for them, make them understand the interconnection, relate it to their lived experiences, and contextualize to things they already experience. Then they get it to political leaders. Political leaders listen. Political leaders listen, the world listens. Thanks.
Excellent. Thank you very much. Thank you so much. And I wanted to spare 2 minutes to ask whether there is a young person here. Who is the youngest person in the room? Is just, let's. Who is the youngest person? Maria is raising her hand up. Okay, are you the youngest person? Okay, we'll assume you're the youngest person. Please come here, and I want you to, in 1 minute, just tell us what you think we need to do differently. Yeah? I'll say again, come up here, let us know. Oh, there, Mike? Sorry? Let us know what do you think we need to, listening to this conversation, and in a very short time, what do you think we need to do differently? Okay, we have 2 young people here.
Yeah, we can.
We'll not ask them who is younger than the other. Just go ahead. And, yes.
Okay, can I? Okay. So for me, as an African, and I come from a Saharan country, the thing I would like to say is please use the youth voice and civil society and community health workers to help in the communication, because you talked a lot about the tools. We don't even know them. And it's really important for us to relay the information, because in our countries there is the climate change and people are just facing it and they don't know how to address and how to behave because of that. So the advocacy that I would like to do, really use the youth voice, and we are here for you, to help you, to support you, and then it's a common goal for us to reach what we need, because climate change is on malaria, the food, everything. So really, that's what I would like to say. Thank you.
And now the really, really young person. Yeah, please. 1 minute. Yes.
Well, I echo what my fellow said. I'm here to, I'm a fellow for SOTA care, so surgical obstetric trauma and anesthesia. I'm sorry, I'm very. But yeah, definitely communicating, definitely inform young people and give young people the tools to mobilize and listen to us, give us a voice, because we have it, and sometimes we do feel a little bit neglected on what we expect our governments to do and to give us. So thank you.
Thank you very much.
If you can wait 1 second. So on behalf of all of us, the panelists, well done, bow. It's wonderful. And a special thank you to Gitinji, but I'm not going to let him go so easily. Gitinji, you've heard from everybody, you asked everybody, but we haven't heard from you. So if you could tell us in 1 minute, what gives you hope?
Thank you very much, Naveen. What gives me hope is this card that you're sitting on. Please pick this card out. It is on your seat. This card is actually calling upon you to join the movement. And that movement is the movement for climate justice. And that movement is being led by Rockefeller Foundation. It is being led by AMREF. There is also the Global Health, Climate and Health Alliance, and there is Wellcome Trust as well. But we want you to be part of it, so scan that QR code and join this movement, because what gives me hope is that all of us are here, and we are all looking forward to making change. Thank you very much. Back to you, Naveen.
Thank you, thank you, thank you. In the spirit of symmetry, we'll end today's session with a final video. This time from climate and health campaigner Shweta Narayan, a representative of the forward-thinking group Healthcare Without Harm. She joins us from India.
I would like to thank the Rockefeller Foundation for the invitation to join this important session. My name is Shweta Narayan, and I'm the climate and health campaigner with international NGO Healthcare Without Harm. I'm based out of India. This year has been a sobering reminder that the climate crisis is not a crisis of the future. We are already living in it. From the hottest year on record to wildfires and floods that have ravaged towns and cities, the evidence is in front of us if we dare to look. In this crisis, where marginalized communities face the harshest impacts, healthcare is central to addressing our climate trauma. Extreme climate events not only threaten people's health, but also healthcare's own infrastructure and capacity to respond. However, there is a troubling paradox here. While the health sector plays a central role in responding to the climate crisis, the sector itself contributes to more than 5% of net global greenhouse gas emissions. The health sector is awakening to both its climate vulnerability and its own climate impact. Many here today are part of this crucial movement. In recent years, we have witnessed tremendous momentum towards climate-resilient, low-carbon healthcare. Just last month, for the first time ever, G20 heads of state recognized the climate and health connection. They endorsed healthcare resilience and decarbonization as a priority, supporting implementation through multilateral development banks and the WHO-led Alliance for Transformative Action on Climate and Health. We are also seeing a growing number of bilateral aid agencies and health philanthropies enlisting in the cause. I'm inspired to see increasing examples of how this transformative vision can be implemented at local and regional levels. Over the past 3 years, 78 healthcare institutions representing over 14,000 hospitals and health centers in 28 countries on every continent have joined Healthcare Without Harm and the UNFCCC high-level climate champions in the race to zero, working to decarbonize healthcare. Wealthy countries with high-emitting health systems in Europe and North America are increasingly taking actions to move towards resilience and net zero emissions. They must do more and move faster. Meanwhile, low and middle-income countries' health systems are striving to build climate resilience, low-carbon health development, and universal health coverage. From Peru to Colombia, India to Indonesia, Ethiopia to Sierra Leone, national and local health systems are taking a series of climate actions, including measuring the climate footprint and assessing the climate vulnerabilities, creating action plans, and implementing a diversity of interventions to adapt, to become resilient, to decarbonize, and to increase health access. Importantly, health professionals have helped drive this action. As some of the most trusted voices in our society, when health professionals champion the cause of Earth, people listen. Dr. Arvind Kumar, here with us in Berlin today, leads Doctors for Clean Air and Climate Action in India, rallying thousands of doctors to advocate for better policies on fossil fuels, air pollution, and health. Our window to avert a climate catastrophe is fast closing. Amid the escalating crisis, healthcare must take the lead with bold and courageous actions, building a movement for climate justice and health justice while driving innovation to transform healthcare delivery. To do this, I believe we must invest in sustainable buildings, green transportation, and clean and healthy energy for resilient healthcare. We must prioritize support for health workers and achieve green universal health coverage. And we must empower health authorities at all levels to get this done. Strengthening health systems should also be about community engagement and participation to ensure climate justice and health equity so that no one is left behind. To protect public health from climate change, the health sector must become a leading voice for a rapid, just, and equitable transition away from fossil fuels towards accessible, affordable, renewable, and healthy energy. If we cannot rapidly kick civilization's fossil fuel addiction, many of our efforts at health development will be in vain. Let me be clear here. The health sector cannot adapt its way out of the climate crisis. Advocating for a just and healthy transition is consistent with the health community's rich history of driving social change, influencing policies, challenging norms, and championing transformation. Be it taking on tobacco, organizing for women's rights, preventing nuclear war, fighting HIV/AIDS, or advocating for racial equity, health professionals have significantly contributed to social movements by examining issues through the lens of public health and generating evidence. Today, healthcare can be a beacon of hope amid the climate crisis, setting an example not only within our own sector, but also for a larger societal transition. By prioritizing sustainable practices, low-carbon systems, healthy energy, and community engagement, we can place health at the heart of climate action, demonstrating that the healthy planet and healthy people are interconnected and inseparably bound to each other. And by uniting the entire sector and empowering its members to serve as champions for rapid and just transition away from fossil fuels, we can orchestrate the greatest public health intervention ever undertaken. The essence of the Hippocratic Oath of first do no harm is calling on us in the most dire moment to take on the climate crisis. We must transform the narrative and position health and healthcare as a central force within the largest social movement in human history. Thank you.
So we've come to the end. As I said in the beginning, I was least expecting such a big crowd, and I'm amazed to see that everyone actually stayed through this whole event. I really do believe it is because of the topic, climate change and health, and we all see it in our own lives, and we can see where we are headed if we don't make a change now. I want to end on a high note. I want to bring the energy back up. So it is really important that the cards that were on your chair, there is a QR code. If you'd like to join the community, scan it. There's obviously no obligations, no hidden agendas. It is that we'd like to come together and form a community and say enough is enough. We need to do something, not just for ourselves, but for the future generations also. So again, thank you for coming. It's wonderful to see you. I think the main session starts in 45 minutes, and so look forward to a good World Health Summit. Thank you.